Everyone, welcome in this channel. I am Dr. Vijay Prince Prasad, Professor of Human Physiology. Today I am going to talk about dyspnea. What is dyspnea? And I am going to talk about dyspnea in different headings. Definition, causes of dyspnea, then staging of dyspnea, effects of dyspnea, treatment and prognosis of dyspnea. Dyspnea is difficulty in breathing. It is shortness of breathing. A patient cannot breathe properly regularly. This is dyspnea. Shortness of breathing or difficult breathing is known as dyspnea. We are not conscious about respiration. We are not conscious that I am taking breathing. But when it becomes difficult, painful, then we are concerned about. We feel that our breathing is not normal. So, American Thoracic Society, American According to this American Thoracic Society, dyspnea is a subjective experience of breathing disturbance, discomfort that consists of qualitative distinct sensation that vary in intensity. Again, I repeat, it is a subjective experience of breathing discomfort that consists of qualitatively distinct sensations that vary in intensity. This is definition of dyspnea by American Thoracic Society. In normal, when we feel difficulty in taking breath, then this is dyspnea. Painful breathing is dyspnea. Shortness of breathing is dyspnea. That when I am not taking proper breathing, then this is dyspnea, and I will feel air hunger. Try to take more air or oxygen in my body. This is definition. Now, causes of multiple factors, multiple causes are there that may produce dyspnea. First is respiratory system. In respiratory system, you see in pneumonia, when there is pneumonia, asthma, pneumothorax, hydrothorax, pleural effusion, breathing is difficult. Then breathing becomes difficult. Then this is respiratory center. Respiratory system. When due to some cause respiratory centers are depressed by drugs or something like that, then this will also cause dyspnea. Respiratory system, then cardiovascular system. Cardiovascular system. Congestive cardiac failure, or myocardial infarction, acute myocardial infarction, all these things will produce dyspnea. Then coming to musculoskeletal. Muscles involved in respiration or nerves supplying to those muscles are defective or infected, then this will cause dyspnea. Difficulty in breathing. Injury to muscles or ribs, etc. will cause dyspnea. Then neurological. Neurological. Suppose multiple sclerosis, spinal cord injury, phrenic nerve injury, all will cause dyspnea. Then endocrine, endocrinology, endocrinal system will also cause dyspnea. For example, is metabolic acidosis. Then psychiatric causes, anxiety. In anxiety and stress, there is dyspnea. Then environmental causes are pollutions, sudden change of temperature. All these things will cause or may cause dyspnea. This is about causes of dyspnea. We described in different headings: respiratory system due to involvement of respiratory system, cardiovascular system, musculoskeletal system, neurological, endocrinal, then psychiatric cause, environmental cause, and one more, that is hematological cause. In case of anemia, for example, in case of anemia, patient is dyspneic. These are the main causes of dyspnea. Now, some special types of dyspnea. Number one, cardiac dyspnea. Number two, due to heart failure, congestive cardiac failure, cardiac dyspnea. Then orthopnea, dyspnea in lying down condition. When one is lying down, there is dyspnea, and he will sit or stand to get relief from dyspnea. In dyspnea in standing position or sitting position. Then bendopnea, that is in bending condition there will be dyspnea. These are the some different types of special types of dyspnea: cardiac dyspnea, orthopnea, platelopnea, or bendopnea. Now coming to staging. Now coming to staging or grading. Grading of dyspnea. According to MRC breathlessness scale. According to MRC breathlessness scale, there are five grades of dyspnea. Number one, no dyspnea. No dyspnea, it will occur when there is excessive exercise, external exercise or physical activity. Then dyspnea will appear. Otherwise, there is no dyspnea. Number two, that is a stage 2. Stage 2, this is stage 1. Stage 2, that is during walking rapidly, or during climbing stairs or walking rapidly, then there may be dyspnea. Stage 2. Now stage 3, walking slowly for 15 minutes walking slowly, regularly for 15 minutes, then dyspnea will appear. Stage 4. In stage 4, patient will stop after few minutes due to dyspnea. This is stops after few minutes of walking. Number 5, not able to leave the house. Dyspnea is so prominent, so serious that he cannot leave his house. This is MRC staging. Second staging is also there. Second stage, sorry. Second stage is 5-point Likert scale. 5-point Likert scale. It is also 5-point. Number 1, no dyspnea. Number 2, mild. Number 3, moderate. Number 4, serious, severe, and number 5, very severe. No dyspnea, mild dyspnea, moderate dyspnea, severe dyspnea, and no dyspnea. This is 5-point Likert scale. Now, pathophysiology of dyspnea. I am going to give some tips about dyspnea. So please continue this video till end. Pathology of dyspnea. Pathophysiology of dyspnea. During respiration, normal, that is average tidal volume is 500 ml and average respiratory rate is taken as 12. Then this is 600 milliliter or 6 liter. 6 liter is average pulmonary ventilation. But all air does not take part in gaseous exchange due to dead space, due to presence of dead space. Dead space in respiratory system is a space, that is conducting zone, a space or volume of gas that is not taking part in gaseous exchange. It is normally 150 ml. So this is pulmonary ventilation. Tidal volume, now tidal volume becomes 500 minus 150 ml, that is 350 ml of air enters into the respiratory zone where gaseous exchange are taking place. Then this is about 4 liters. When there is dyspnea, this alveolar ventilation reduces. Alveolar ventilation reduces, then only say 200 milliliter or 150 ml, 200 milliliter or 150 milliliter of air is going into the respiratory zone where gaseous exchange is taking place. And therefore, there is air hunger. want to take more oxygen, and this is air hunger. This is the cause of air hunger. Number one, increased awareness of breathing. Awareness of breathing. As I told you, or you may have experienced, that no one is very conscious about his breathing. No one thinks that he is taking breath unless it is disturbed. When increased awareness of breathing, for example, in anxiety and stress conditions, one is aware of breathing, or think someone is watching, then breathing will increase in size, increase awareness. Then second is work done in breathing increases. In asthma, work done is more. Emphysema, work done is more, and this will cause dyspnea. Number three, defect in abnormality in respiratory system. Respiratory system and other systems also. This may cause, these abnormalities may cause dyspnea. This is about pathophysiology of dyspnea. Now, what is the treatment? Treatment protocol is treat the underlying cause. For example, when anemia is due to when dyspnea is due to pneumonia, then we have to correct pneumonia, and this will cure dyspnea. When someone is suffering from anemia, that is low amount of hemoglobin and RBC, then we may correct anemia and dyspnea will disappear. Suppose someone is having pleural effusion. In that case, pleural tapping, removal of the pleural fluid from the pleural space will relieve dyspnea. That is treatment of the cause. Prognosis. Prognosis depends upon the cause. Prognosis depends upon the underlying disease or underlying cause. For example, if it is due to myocardial infarction, then prognosis is very bad. Prognosis is worse in case of myocardial infarction. These are about dyspnea. Main points of dyspnea I have discussed. If you have any doubt, any ideas, then please write it in comment box, and please help us to improve the video. Detail you may get into my blogs totalphysiology.com and learnandfly.co.in. You may get details. Link is given in the description. Okay, thank you very much for watching. Please like and share this video and subscribe this channel. Thank you for watching.